Hello, Dr. Ross Walker and welcome to Miskawaan Cardio. I'm often asked, is heart disease reversible? And the answer that most people give is no, it just happens and gets worse as you get older. But I don't believe that. I believe if you do all the right things, you can actually reverse heart disease. Now, firstly, and here's the problem, most of the studies have been done on fat Americans who don't look after themselves well. So statins, for example, will slow the process down, but not stop it, certainly not reverse it. But if you look at the 5 components of the patients in my practice who do very well, number one, and 80% is how they manage their lifestyle. So lifestyle is 80%. Without that, you're not going to reverse heart disease. So you've got to lose weight. You've got to get rid of the cigarettes if you're smoking. You've got to manage the stresses in your life. You've got to look at how you eat and keep your exercise up, sleep better. All those 5 keys of being healthy. That's the first bit of reversing heart disease. The next bit is the appropriate management of cholesterol. And many people are anti-statin, but if you've got heart disease and you want to reverse the disease, you need to be on whatever dose of statin you can be on that's going to start reducing the size of the plaques in your arteries. That's cardiac reversal. But with the statin, I give a thing called Bergamet Pro Plus, sometimes called Cardio Plus. And this comes from bergamot oranges grown on the southern Ionic strip of Calabria. It's the juice of the orange that have these very strong plant chemicals that work with the statins to reduce the size of your plaque. Now, in people that I'm not demonstrating reversal in, I also add in a very old style drug called nicotinic acid, which is a version of vitamin B3. And what this does is help pull the fat out of the arteries with the statin, with the bergamet. It also shifts your cholesterol from what we call small to large LDL, small to large HDL, which again is part of the reversal pattern. And the bergamet and the nicotinic acid are involved in what we call reverse cholesterol transport, where you're taking cholesterol out of the wall of the arteries and breaking it down into harmless substances. So that management of cholesterol, that triple therapy, whatever dose of statin you can tolerate, Bergamet Pro Plus and nicotinic acid, are the keys at the moment of reversing the cholesterol component of your heart disease. But there's some exciting things happening over the next few years. Right at the moment, there's a very expensive treatment you can have called PCSK9 inhibition, which is an injection every fortnight. But this can hammer your LDL cholesterol down to very, very low levels. In certain areas in the world, it is covered by government subsidy, but it can be very expensive. And it is a commitment to having an injection once a fortnight. Coming through in the next couple of years is a drug called inclisiran, which is an injection every 6 months. And so this thing can pulverize your LDL cholesterol just by having a shot every 6 months, which is pretty exciting stuff. I've spoken before about lipoprotein a, which is the cause of 20% of heart disease. And again, we're developing this new treatment called antisense oligonucleotide, an injection once a month that pulverizes LP-A. Coming out over the next few years is a drug called bempedoic acid, which works a bit beyond the statin pathway, so it doesn't cause the muscle aches and pains, but still lowers LDL cholesterol. So working on that cholesterol and getting it down to very low levels, and your doctor will tell you exactly what target he wants to get you to, is a vital component of reversal of heart disease, as is exquisite management of your blood pressure. Whatever regimen it takes to get your blood pressure down to 120 on 80 will be part of the reversal process. Staying on low-dose aspirin is very important. Treating other conditions, very important. So I believe it is possible to reverse heart disease, but it requires pretty significant effort on your part and also on the part of your doctor.